researchers. There are few people, if any, who have more respect for their work over many years that's grounded in Indigenous communities, Aboriginal and Torres Strait Islander communities throughout the land, which has engendered enormous respect both in Indigenous communities and in non-Indigenous communities for her work. Her analysis, her perspicacity, and which is generated from the respect she has generated through the years, is enormous. Please welcome Professor Marcia Langton, who is Chair of Australian Indigenous Studies at the University of Melbourne.
Thank you, Norman, for that very generous welcome. Thank you, my Ngambri sisters, for your very warm welcome, and it's lovely to be on your country again. Thank you to the Foundation for inviting me to launch this excellent report. I also acknowledge some of the people here who have contributed to the research, and all of you. Thank you. Beyond the drinker, alcohol's hidden costs. The commissioning of this research on the harm to others caused by heavy drinkers of alcohol in Australia has resulted in the first accurate picture of the impacts and costs. Leaving aside the financial costs, which have already been mentioned, which are harsh enough, the social impacts have also been identified by this research. Almost 3/4 of adult Australians have been negatively affected by someone else's drinking. This represents 10 million Australians who suffered adverse effects by others' drinking, and of these 2 million were affected a lot. Young people were 3 times more likely to report harms. And in one of the many graphs of tables in the report, young people had a social event ruined by other people's drinking, and the percentage was 67% of the young people surveyed. So throughout this report there are figures like that, and there isn't the time to tell you about so many of the very important issues identified. You can read these findings and more in this excellent report. Its great contribution is to counter the force of the liquor industry's lobbying on government by quantifying the harm done to others by heavy drinkers of alcohol, or drinkers, yes, okay, that'll do, in terms of financial costs, health impacts, opportunity costs, and much more. The view put by the alcohol industry is, to quote Mal Higgs, President of the Australian Liquor Stores Association, on their representatives, Liquor Stores Association, one of their representatives, said last year about increasing the price of alcohol, the public won't cop it. There is little evidence for this assertion and much more evidence to the contrary. Australians want responsible drinking of alcohol, and most realise that this means using a range of policies, laws and strategies to reduce the amount of alcohol consumed, to increase the taxes on alcohol so that cheap alcohol is not accessible by the young and the vulnerable, but also to make the drinkers pay for the harm they cause to others through additional taxes, to regulate the advertising of alcohol so that the young and the vulnerable are not persuaded by the industry's lure of grandiose attributes of social, sexual and physical strength of their fictional advertising characters, to regulate where and when alcohol is consumed, especially to regulate more strictly the public behaviour of alcohol users on the roads, in public places, involved in duties of care towards children, so that levels of violence, death and harm are reduced. I'm concerned about how government, state, federal and territory respond to these challenges. Much of my concern arises from my understanding of the impact of alcohol abuse in Aboriginal communities, an understanding hard won through decades of experience. My friend Pat Anderson, co-author with Rex Wild QC of the report Little Children Are Sacred on the extent of child abuse in Aboriginal communities in the Northern Territory, used the term rivers of grog. As chair of the board of the Cape York Institute for Policy and Leadership for the previous 5 years, I have observed the enthusiasm of several Cape York Aboriginal communities for alcohol management plans. Women residents of these communities worked hard to ensure that they were established. Some men, too, worked hard, none more so than Noel Pearson. While it is sometimes asserted that the comportment or style of alcohol consumption in Aboriginal communities is somewhat different to that of other Australians, one thing is clear: a minority of Aboriginal people consume alcohol. A report on Aboriginal alcohol use and related problems published by the Australian Council on Alcohol and Drugs recognised that a large proportion of Aboriginal people, particularly women, do not drink alcohol. It is also noted, however, that those Aboriginal people who do drink alcohol do so at levels that are considerably higher than for the broader population and at levels which are considered hazardous and harmful to their health. And of now, we must also say, and to others. Despite the minority of Aboriginal alcohol users, alcohol looms large in the problem of closing the gap on Indigenous disadvantage. Moreover, alcohol is ruining our future. Our young are disproportionately affected, and our cultural traditions are in jeopardy given the levels of harm that alcohol causes in the Indigenous world. Aboriginal women, like other Australian women, are being enticed into drinking by advertising and public pressure, with disastrous results, especially for children. One of the more alarming revelations of recent research is the impact on the unborn child of maternal alcohol consumption on the newborn. And I'd like to say that in addition to the many recommendations for future research in this report, we urgently need research on fetal alcohol spectrum in Aboriginal communities. I know that the previous government might have slipped some funding to that area of research before it went into caretaker mode, but this is tremendously important. And, you know, given the figures that you've reported, and say the highest is in Queensland, where it's 15 per 100,000, and reading what you've said, I actually think it's not being reported at the rate at which it occurs, and you're nodding, and I can see that you agree with me. Moderate to heavy alcohol consumption by a pregnant woman can result in her child being born with fetal alcohol syndrome and fetal alcohol effects. I think one of the reasons why it's not more reported is because of the revolving door of health staff who are not trained to recognise it. It is sometimes a subtle range of symptoms, and, you know, by the time the child is 7, it's not at all subtle. So I think we need to invest in training health staff in this area. And it is, of course, now understood to be the leading known environmental cause of mental retardation in the Western world. According to Hayes, author of Children of the Grog, a study of maternal drinking in Aboriginal communities. The impacts on the options in life for individuals born with this syndrome can be profound. In more extreme cases, the children are unable to learn and are severely mentally disabled. Alcohol can have a variety of effects on the unborn fetus, which are related to the amount of alcohol consumed by the woman, at what stage during the pregnancy the alcohol was drunk, and the genetic makeup of the mother and child. The risks of prematurity, small for gestational age, and miscarriage, as well as congenital abnormalities, are 3 times higher in drinkers. So it's also been suggested that there are no safe limits of alcohol consumption by pregnant women. Hayes found in her research in Aboriginal communities that 43% of Indigenous women drank during pregnancy, and 34% of them were heavy drinkers. Women who drank had more than 3 times more risk of having a low birth weight baby. And the children showed significantly higher scores in behavioural problems at 5 years of age compared to children of mothers who did not drink. In research, a research project being developed by Stephen Isles, myself and others through the Cape York Institute, we've thrown up some hard data in this research design phase. Stephen Isles has critically interrogated the data collected and the assumptions and conclusions made by the Queensland Crime and Misconduct Commission report of its inquiry into Indigenous crime in Queensland. We believe that the Commission has misinterpreted the data. The Commission reported no reduction in crime against the person in Cape York communities due to alcohol management plans. However, Stephen's interrogation of the data showed that they'd completely ignored hospitalisation data, which I see this report relies on very heavily. So we tested the hospitalisation data rather than the crime data. These are the findings in our first phase. Significant reduction in the rate of hospitalisations for assault in Cape York communities after alcohol management plans were implemented. At a 99% confidence interval, we have rejected the null hypothesis. There has been a significant decrease in the number of hospitalisations for assault. In fact, the stricter the alcohol management plan, the larger the decrease in hospital admissions. So I want to see not only more research, I want to see governments take up the challenge of this series of impacts, not only for all Australians, but in particular for those Aboriginal communities that are targeted by the alcohol industry. What types of programs should government support? Limitations on individual purchasing, Aboriginal canteen limits, licensing commissions should do more. In Western Australia, there's some very interesting advances. Licences should be rescinded in many cases, and there should be many more rigorous inspections. And in fact, I think some of the canteens in Queensland Aboriginal communities have been voluntarily closed by the communities simply because there's such a harm to these communities. Many of us do not now agree with the harm minimisation approach, especially because of the rising concern amongst Aboriginal women about fetal alcohol spectrum. So what types of programs are communities promoting? Closure of licences, limitation of licensee hours, rehabilitation centres, dry-out centres, sobering up shelters. And what types of research are we supporting? The supply and demand approach and pricing policies. Aboriginal communities with a concern about this issue are particularly keen to stop supermarkets from selling cheap liquor. Because we need government policies to formalise these strategies and their implementation in many more communities, I was thrilled to read this report. I congratulate all those who contributed to it for the reasons I have mentioned. The future of Australians, and especially Indigenous Australians, and their well-being depends on responsible governments. I hope they read this report and I hope they act on it, and I congratulate you all and hereby launch it.